When were we happy? By the time girls reach 13 years old, 53% report being unhappy with their bodies. At what age does self-realization become inflicted with negativity and a danger of a distorted body image appear? When were we happy? To begin to explain this, we must first ask, what is body image? A two-dimensional model of body image incorporates both perceptual and emotional components. It focuses on both how we feel about the size and shape of our bodies and how accurately we perceive our body as well. A more recent cognitive approach suggests that body image is a complex set of cognitive schema. A schema is a group body of knowledge. Groups of schema are readily available for important tasks such as guiding behavior, circumstantial scripts or dialogue, and evoking the appropriate emotional, somatic, visual, and auditory responses in certain situations. The cognitive schema for body image is an organized domain of knowledge about oneself and others. Different situations evoke different schema. For example, watching a runaway model on TV may provoke the low confidence schema, while being complimented on your body or looks will naturally provoke a higher confidence and the I look good schema. Early results from the world's largest study of body image in early childhood, run by La Trobe University, shows that both boys and girls develop size stereotypes early. The study follows children from the ages of 3 to 8 to determine at what age and how their observations can turn into body dissatisfaction. Children were shown pictures of different bodies and asked about positive and negative characteristics and what body shape they would prefer for themselves. Already in such early ages, the children were both able to recognize a preferred stereotype and have an ideal body shape or size. Dr. Stephanie Damiano of the School of Psychological Science said that while there was so far little evidence of body dissatisfaction in children aged 3 and 4, they typically wanted to be larger. We see that there is a repetitive behavior when it comes to imitating and copying in several of the psychoanalytical infant studies that have been documented throughout time. Among them, Stern's theory on infant development states that children between 4 to 7 months of age, when the core self starts to develop, already begins to synchronize their behavior with their parents' behavior and resemble their actions. When the intersubjective self develops around 7 to 9 months of age, Stern says that the child is now able to imitate the parents' way of treating different objects and situations. To illustrate this, a study was made when an infant gets placed in a situation of insecurity and by the help of a toy or an enticement is lured over a visual gorge in the shape of a glass plate. This creates the illusion that the child is moving over a dangerous deep gorge. In this situation, the infant will look over at his or her mother to study her reaction towards this dangerous situation. If the mother has been instructed to express positivity in the shape of a smile or other encouragement, the child will cross the visual gorge. If the mother has been instructed otherwise, the child will avoid it. In other words, the study proves to us how infants react according to others. Not only Stern, but also Erikson's psychosocial theory, where the child in phase 3, from 3 to 5 years old, starts to ask questions in order to mirror the older figures. This is an ability that follows the child through life, where in many situations he or she will try to copy the acts of their parents or guardians. In a situation of insecurity regarding the body image or other confidence issues, the child might try to have the same values and perspective as the people around them, preferably older figures. We see here how important it is that these figures have a healthy relationship to themselves in order to transfer this onto the people who look up to them. If their perception of themselves is impaired in any way, it is easier for the child to mimic this and be influenced by their perspective of themselves. The final article I've gathered to dig deeper into children's self-image and body view is an article by Marie C. She photographed and interviewed 4 to 8-year-old girls and asked them what they liked the most about their bodies to find out what they value and if they already are able to recognize stereotypes. We see here that these young girls value slight different ideals than the average grown-up does, but some of them have already in such young age picked up on what probably are the older role models, standards and ideals, For example, some of them want long legs, long eyelashes, etc. But they also mention things such as my eyes because they help me see, my hands because they help me draw, and my whole body I love. In these cases, they have not yet been exposed to the negative cognitive schemas. Therefore, I conclude that the negative body image schema can develop already in very early stages of life, and that children become aware of others' body ideals already at the age of 3 to 4. Children are especially sensitive to their parents' and older role models' influence and repetitively try to obtain their values throughout childhood in order to reflect and copy their actions and body ideals. Thus, it is extremely important to expose children to the right values and not to emphasize unhealthy body images throughout childhood.